the European Union's response to the COVID-19 pandemic. Introduction. People have criticized the epidemic response for being untimely and unequal, with some countries implementing stricter regulations than others. The stagnant vaccination deployment, lack of cooperation among member countries, inconsistent visa restrictions, and economic effects have all been issues with the EU's COVID-19 program. The EU might respond to the pandemic more quickly and effectively, as well as lessen its impact on people and the economy, by putting these proposals into practice in a coordinated and thorough manner. To guarantee that vaccines are distributed equitably and effectively among member states, the EU might create a centralized vaccine distribution system. The EU should ally with member states and other stakeholders to advance the policy of COVID-19 and overcome resistance from those who disapprove of it. The European Union has implemented steps to impede the virus's transmission, including intensified testing, case management, and physical separation. The EU has also offered advice on how to manage epidemics in various contexts, including hospitals and nursing homes, and how to utilize personal protective equipment. The EU has also asked its members to cooperate and exchange information to combat the pandemic. Background issue. The virus, which was discovered for the first time in Wuhan, China, in December 2019, moved fast around the world and was dubbed a pandemic by the World Health Organization. The virus can produce a variety of symptoms, ranging in severity from effects ranging, and it typically transmits through coughing or sneezing. The virus can also cause serious respiratory illnesses, including the potentially fatal COVID-19. In addition to the death toll, the epidemic has had a severe effect on the world economy, leading to the closure of numerous firms and an increase in unemployment rates. The European Union's reaction to the COVID-19 pandemic has implemented several initiatives. In addition to attempts to assist the economy and healthcare systems, these policies also involve steps to inhibit the spread of the virus, such as lockdowns and travel restrictions. Additionally, the EU worked with its members to coordinate the purchase and distribution of vaccines. However, the pandemic reaction has drawn criticism for being tardy and uneven, with some nations adopting tighter policies than others. Vaccination attempts have been delayed because of problems with vaccine availability and delivery. The EU imposed a lockdown on the entire continent to halt the virus's spread and prevent further outbreaks. Problems. Regarding the COVID-19 pandemic, there have been several concerns with EU policy. A few of the most significant ones are as follows. Slow vaccine deployment. The EU has come under fire for its slower-than-average vaccine rollout, which includes bottlenecks in vaccine distribution and deliveries. Lack of coordination. The EU's response to the pandemic has come under fire for member states' lack of coordination, with some enacting tighter regulations while others are laxer. Restrictions on travel. The EU has taken a haphazard approach to travel restrictions, with separate member states enforcing varying laws and specifications for travelers. Economic impact. The pandemic has had a significant negative financial impact on the EU, resulting in many business closures and substantial unemployment. Public confidence. Some residents have voiced a lack of faith in the EU and the national government's capacity to combat the pandemic effectively. Problems with the supply chain. Some member states have experienced shortages of PPE and other supplies, making it harder for them to respond to the epidemic. It is crucial to recognize that the pandemic is a dynamic scenario that will continue to evolve, and remedies may need to be adjusted as more information becomes available. Solutions. The EU could deploy several potential remedies to solve the issues with its COVID-19 policy. Increase production and distribution of vaccines. Accelerate the deployment of vaccines by increasing the production and distribution of vaccines. Improve coordination among member states. The EU could establish better procedures for member state collaboration to ensure a more coordinated and successful response to the epidemic. Implement uniform travel limits. To clear up any ambiguity and ensure that passengers are informed of the laws and procedures in each nation, the EU might endeavor to establish more uniform travel restrictions among its member states. Economic support. To lessen the financial impact of the epidemic, the EU should offer financial assistance to organizations and people impacted by it. Enhancing transparency in communication. To earn the public's trust and improve understanding of their actions, the EU and national governments must engage in more open and transparent communication with the public. Enhance supply chain management. The EU might collaborate to enhance supply chain management and ensure that member states have enough personal protective equipment and other equipment to respond to the pandemic. Overall, the EU has been actively responding to the pandemic by implementing a thorough strategy to tackle it. Conclusion. In the context of the COVID-19 pandemic, finding answers and getting through resistance might be difficult because it calls for juggling competing interests like public health and economic prosperity. To coordinate the pandemic responses and ensure uniformity across national governments, the EU might create a joint task force with members from its member states. To hasten the development of new vaccinations and treatments, the EU may decide to enhance funds for research and development. The EU and national governments must interact with the public more openly and transparently if they hope to win the people's trust and understanding of their policies. Providing accurate and current information on the pandemic and the steps being taken to combat it will help the EU answer citizens' concerns. To ensure that their opinions and needs are considered, the EU might involve stakeholders in the development and implementation of policy, including businesses and healthcare professionals. The EU should create an alignment of participating countries and other stakeholders to promote COVID-19 policies and overcome resistance from those who disapprove of them.